SAD, or seasonal affective disorder, affects millions of Americans. ABC 7 medical contributor Dr. Ogechika Alozie with Sunset West Health is here with the facts about SAD, and it's appropriate. It stands for sad.
Exactly. So
what I mean, it's more than the winter blues, right?
Absolutely. So seasonal affective disorder, SAD, is really something that happens mostly in northern hemispheres. So think about the Midwest, Chicago, and Minneapolis, and Iowa. But it can also happen here because daylight is shorter. It starts getting darker. People aren't outside as much. They can't be active as much. And as we know from this week, it gets a lot colder, right? And so it's something to be thought about because it can actually cause active depression and make people very sick.
How many people are affected by seasonal affective disorder?
You know, it's hard. These estimates vary. I'd say somewhere between 1 and 10 million, depending on how you count it. But what's remarkable about it is that out of the people that get it, 4 out of 5 are women. Right, and so it's really important that if you're a female and you start to feel tired, you start to add weight, you just don't want to be around people, especially now during this holiday season, that you find help, and we can help you through this.
Okay, now let's talk about what causes SAD.
Yeah, that's harder to tell. I mean, brain chemicals are one, the whole serotonin levels that you get from the sun, your melatonin actually reduces, so you're not able to sleep as well. And so sunlight, as much as we take it for granted in this El Paso region, I mean, we're blessed typically with a lot of sun. When that sunlight reduces, it can actually have biochemical effects on your body, and that's why you have to be attuned to this.
Does seasonal affective disorder tend to affect those who are already facing a mental health issue?
They're more at risk. Right? So if you're already prone to have anxiety or depression, it can affect you even more, right? And so we can see from this slide that whether it's anxiety, depression, a combination, or bipolar, this is the prevalence in those that already have that can develop seasonal affective disorder. So again, why you need to be on the watch for it. And I think what we try to do is not tell people, go out and look for something, but know the keys so that you can get help.
So if someone thinks they may be affected by SAD, what should they do?
I think the biggest thing to do is understand yourself and have that insight to say, I don't feel right. Right? I'm sleeping way too much. I'm eating more. I don't want to be engaged with people. I don't want to be engaged in activities. And then look for help. And whether it's light therapy, whether it's taking vitamin D, whether it's taking medications, right? That's the last resort. But there are a host of things that can actually help you. And you know, we've talked about sun tanning and the effects of sun tanning on skin cancer. This is actually one spot where sun tanning can actually help. That light can actually stimulate your brain and help you get better.
And there are some local resources people can turn to.
Absolutely. And so there's a host of resources on here. We've talked about this before in depression. And you know, one thing I will say to people that if you are scared or you're worried or you have stigma about going someplace, remember, there's always online apps and resources that can help you do counseling and get through it in the privacy of your own home.
ABC 7 medical contributor Dr. Ogechika Alozie, thank you so much.
Thank you.